So we're going to talk about the cervical lymph node levels. It's very difficult. Some people see it as very difficult, but it's so easy. Once you just understand the landmarks, it is very easy. So generally we describe 6 or 7 levels surgically, and radiologically we divide them into 7 levels. Let's begin with level 1. Level 1 is the same as the submental and submandibular lymph nodes. Okay, so basically inferiorly is the inferior border of the hyoid. You see, this is hyoid and this is the inferior border of the hyoid. That's the inferior border of this triangle. Superiorly is the mandible, right? Superiorly is the mandible, and the mylohyoid muscle also that forms the floor of the oral cavity, right? So you've got the mandible upwards, superiorly the mandible, and the mylohyoid muscle, and inferiorly the hyoid bone. All right? Okay. Posteriorly is the, what is this? You know this gland? Submandibular gland. Posteriorly is the posterior border of the submandibular gland. Anteriorly is the platysma muscle, right? The platysma muscle, which is extending from the face down and covering basically all of the anterior neck. So that's level 1. Okay. Level 1, again, superiorly is the mandible and mylohyoid. That's one border. Inferiorly is the lower border of the hyoid. Posteriorly is the posterior border of the submandibular gland, and anteriorly is the platysma. And this includes both the submental and submandibular triangles. It is further divided into 1A and 1B, which is basically 1A the submental nodes, and 1B is the submandibular nodes. 1A, you know this muscle, this is digastric muscle. And this is the other digastric muscle. These are the anterior bellies of these muscles. And level 1A is between the two anterior bellies of the two digastric muscles. So this is 1A level here. Okay, between the two digastric muscles, anterior bellies. 1B is posterolateral to the anterior digastric muscle here. Posterior and lateral. So you can just say lateral to the anterior belly of the digastric muscle. This is 1B, which is submandibular nodes. Okay. Level 2. Level 2 is the same as upper deep cervical nodes, which is the same as upper internal jugular lymph nodes. Inferiorly, this level, inferiorly is the same as the inferior border of the hyoid. Do you see? You take a line, just take a line backward here, and you've got your inferior border. That is a horizontal plane from the inferior border of the hyoid bone here. Okay, that is going to be your inferior border. Is that right? The superior border is simply the base of the skull. The superior border is the base of the skull at the level of the jugular foramen or the jugular fossa. Okay? So superiorly base of skull, inferiorly inferior border of hyoid bone. Anteriorly is the posterior border of the submandibular gland here, right? Which is the same as the posterior border for level 1, right? So the anterior border for level 2 is the same as the posterior border for level 1, which is the posterior limit or posterior border of the submandibular gland. So again, superiorly base of skull, that's 1. Inferiorly, that is the level of the hyoid bone. Anteriorly is the posterior border of the submandibular gland. And yes, posteriorly is the posterior border of sternocleidomastoid muscle. Here, right? This line is representative of the posterior border of sternocleidomastoid. So posteriorly is the posterior border of sternocleidomastoid. If you want to add, medially is the internal carotid. But anyway, medially, if you go deep like this, medial, if you just jump inside, like at which depth we will say this is it, that's level 2. It is the depth of the internal carotid artery. Okay, so this level, level 2, is subdivided into 2 levels. So there's subdivisions. There's level 2A, which is just in front of the, what is this? This is internal jugular vein. This is what? Internal jugular vein. So just in front of the internal jugular vein, here, that is going to be level 2A, which contains a group of nodes called jugulodigastric nodes. Right, so jugulodigastric nodes are in level 2A. Jugulodigastric. They call it jugulodigastric because that's where the posterior belly of the digastric, which is this one, crosses the internal jugular vein. So they call it jugulu for internal jugular vein, digastric for the posterior belly of digastric. So jugulodigastric nodes. What is the importance of these nodes? These nodes are draining the oropharynx and most of the oral cavity too. So someone with tonsillitis, for example, right, they can have enlargement of the jugulodigastric lymph nodes. Jugulodigastric lymph nodes. Down below, there are other nodes which are called jugulo-omohyoid nodes. Jugulo-omohyoid nodes. You know the muscle omohyoid, which is, omo means shoulder, right? It's coming from the shoulder. So omo means shoulder. So this muscle is coming from the shoulder, crossing the internal jugular vein here, and then going and attaching to the hyoid. So omo for shoulder, hyoid for hyoid bone. Very simple, right? So at the point where it crosses, there are other nodes which are called jugulo-omohyoid nodes. Jugulo-omohyoid. Now, these jugulo-omohyoid nodes, they drain the tongue. So if someone have tongue cancer, right, these nodes can become bigger. So omo for tongue, remember, omo, you do omo, right? This is like talking with your tongue. So jugulo-omohyoid nodes for tongue, okay? So anyway, let's come back. So level 2A is anterior to the internal jugular vein and contains jugulodigastric nodes. These are enlarged when there is tonsillitis. And behind it here, this is 2B. So 2A, 2B are divided by the posterior border of internal jugular vein. So let's recap so that we are not lost. Let's recap. Level 1, superiorly mandible and mylohyoid. Inferiorly, inferior border of hyoid. Anteriorly, platysma. Posteriorly, posterior border of submandibular gland. It is further subdivided by the anterior belly of digastric muscle into 1A and 1B. 1A is between the two anterior bellies of digastric. These are called submental nodes. And posterolateral to the anterior belly of digastric is 1B, which is called submandibular nodes. Correcto? Claro up to this point? Level 2, we said that the inferior border is the inferior border of the hyoid. Superiorly is the skull base. Posteriorly is the posterior border of sternocleidomastoid. And anteriorly is the posterior border of submandibular gland. And then we said it is also further subdivided into 2A and 2B. 2A is in front of the internal jugular, 2B is behind the internal jugular. Okay, level 3 is easy, so we just finished the difficult parts. The rest of the levels are easy. Level 3 superiorly extends from the inferior border of the hyoid bone here. Okay, let me highlight it here. Inferior border of the hyoid down to the level of the cricoid cartilage, inferior border of the cricoid cartilage. So this is cricoid cartilage, this is thyroid, right? The inferior border of the cricoid, if you take a line from it behind like this will be the inferior border of level 3. So level 3, which is the middle deep cervical lymph nodes, these are extending from the hyoid above to the cricoid below. So superior border is hyoid, inferior border is cricoid. Posterior border is simply the posterior border of sternocleidomastoid muscle, okay, which is here, okay. So posterior border is the posterior border of sternocleidomastoid, and anterior border is the anterior border of sternocleidomastoid. So you can see, very simple. And if you want to add some spices, what's the depth to it? Medially is the common carotid artery, or the depth, right? It is we will consider that depth-wise, medial border is the plane of the common carotid artery. So simply, this is level 3, right? So level 3 anteriorly, anterior border of sternocleidomastoid, it should be here, and posteriorly, posterior border of sternocleidomastoid, superiorly hyoid, inferiorly cricoid. Level 4 is the same as lower internal jugular veins or lower deep cervical lymph nodes or inferior deep cervical lymph nodes. Also very simple. Superiorly is cricoid, right? That's the superior border. Let's use a different color here. Superior border is at level with the inferior border of the cricoid cartilage. The inferior border is at level with the clavicle. Now, the anterior border is the anterior border of sternocleidomastoid. Oh my God, very simple, okay? The posterior border is oblique line, okay? Look carefully. So if we draw a line along the posterior border of sternocleidomastoid, we will draw it like this, okay? But that's not it. That's not the full story. Let me delete that. So actually, there's a small muscle here called anterior scalene, okay, which attaches to the rib 1, anterior scalene. Now, the posterior border is oblique line drawn along the posterior border of sternocleidomastoid, going along the lateral edge of the anterior scalene. So it's all of this, okay? So it includes this little bit also, because it also traverses the lateral edge of the anterior scalene. So again, what are the boundaries of level 4? Superiorly cricoid, inferiorly clavicle, anteriorly sternomastoid, posteriorly sternomastoid and scalenus anterior or anterior scalene. Level 4 contains the Virchow nodes. It includes the supraclavicular nodes of Virchow or Virchow, I don't know, right? So you know what I mean, right? The nodes that are enlarged in basically any infradiaphragmatic malignancy, advanced malignancy like gastric cancer, testicular cancer, whatever, right? Here, they are located here, the Virchow nodes. So did you notice something? That level 4 contains a small part of the posterior triangle of the neck, right? Which is this little bit that includes Virchow nodes or supraclavicular lymph nodes. There are divisions, but I don't want you to know about that. That's too much. So just know level 4 as a one chunk. Now, level 5 is the easiest level. Level 5 is the posterior triangle, except for the small little part here. So what are the boundaries of the posterior triangle? Anteriorly, sternocleidomastoid. Let's use a different color here. Okay. Sternocleidomastoid, posterior border. Along with the anterior edge, of the anterior scalenus. Posteriorly is the trapezius, right? The anterior border of the trapezius muscle. So you've got your posterior triangle. Inferiorly is the middle section of the clavicle, right here. Middle section of the clavicle. And that's it, right? Superiorly is where, the sternocleidomastoid and the trapezius attaches to the skull, you can say. So that is the superior border. So superior border skull, anterior border sternocleidomastoid and lateral edge of scalenus anteriorly. Anterior, posteriorly is the trapezius. It is divided into 2 levels. There are 2 main subdivisions. If you take a horizontal line at the level of the cricoid cartilage, here, okay? This horizontal line at the level of the cricoid cartilage. This part of this triangle above is called 5A. And this part contains the accessory nerve, the spinal accessory. That's so important. It contains the accessory nerve. So the accessory nerve is in level 5A. And 5B is below that, you can say. Very simple. Now finally, level 6. Level 6 is the central nodes, right? These are called central anterior compartment nodes. These contains your pretracheal, prelaryngeal, or precricoid Delphian nodes, right? And paratracheal nodes down below. So this is the central compartment of the neck. It's level 6. It is that compartment that when you have a patient with thyroid cancer, usually we do, if there's nodes involved, we do level 6 dissection, because this contains the nodes that are in the immediate vicinity of the thyroid gland, perithyroidal nodes that drains the thyroid gland. Superiorly, this level 6 is bounded by the hyoid bone here above. Let me use totally different color. Yeah, that's nice color. So superiorly is the superior border of hyoid. Inferiorly is the manubrium, sterni, superior edge of the manubrium here down below. And laterally are the medial borders of the carotid arteries here. Medial border of carotid artery here, medial border of the carotid artery so it's in between the two carotid arteries, you can say, but below the hyoid and above the manubrium, sterni. And anteriorly is your platysma, because platysma covers the anterior neck. And posteriorly is the larynx and trachea in the middle, and the paravertebral spaces just laterally. Fine, claro, guys? Some people add level 7, which is mediastinal nodes. It's in the chest. Level 7 is down in the chest. So these are the levels. I hope that it is clarified. You need to write it down, you need to repeat it. It's a bit, it's easy, okay? It's not that bad. And that's it. Thank you for watching.